Great. Hi, everyone, and welcome. And thank you so much for joining us in the second meeting about COVID-19. Today's conversation will focus on building our understanding about what's happening with COVID-19 and vaccinations in the Latinx community, farm workers, and other BIPOC communities. We also know that nonprofits and community health centers or community clinics are reaching these diverse communities and will play a key role in moving us to a full and equitable recovery. Today, you will learn how you can support and fund these trusted and impactful organizations as they continue to respond to community immediate needs. We would like to see who's in the room here with us today. Could you please update your video with and include your name, your organization, and please feel free to say hi in the chat. Take a minute or so for that. Great. And we do have a polling question for you all. First polling question that we have is, how are you funding the resiliency and strength of community-based organizations and community health centers engaged in vaccine equity efforts? Feel free to choose more than one. You see them, all the responses here. Using racial equity lens for grant making decisions, providing general ops support, funding capacity building, multi-year funding, none of these, something else. Take a few minutes for you to respond. Great. Crystal or Sarah, can you share the responses with us? Great. Oh my goodness, there's a lot of activity that's happening from our Bay Area funding partners. You can see here many of you all are supporting impactful, trusted organizations doing meeting needs and also thinking through how to bring our communities into a full recovery. The one that raises to the top here is providing general operating support. We all can agree that that's really important to have that flexible funding available for nonprofits and community health centers, followed by using racial equity lens for grant making decisions. We know that COVID-19 further amplified racial health disparities among our diverse communities. And then followed by here, funding capacity building support or providing technical assistance, all very important. So thank you for all that you're doing for advocating and also for funding our Bay Area nonprofit ecosystems, including community health centers and community clinics. That being said, I'd love to also introduce our new co-chair for the Bay Area Funders Group. Anitra Smith is joining us as a new co-chair. She's coming to us from the Sunlight Giving. We're very excited to have Anitra join us in this leadership role and helping us think through what kinds of programs we can offer you all as we have the remainder of this year and future programming as well. So with that, I'll hand it off to Anitra. Thank you all again for joining us.
Thank you so much for the introduction, Pedro. As Pedro said, my name is Anitra Smith. I'm really excited to be in community with you all. I'm a program officer with Sunlight Giving. I've worked in family philanthropy for the last 4 years at the intersection of funding health and human services. I'm very passionate about strengthening safety net services for families with young children. I recently joined as the new co-chair for the Bay Area Health Funders Group. And what drove me to join this sort of leadership table is I'm really excited to be in community with other peer health funders and to learn alongside you all and also from you. I think of philanthropy as sort of an ecosystem. And so I think it's really important for us to learn, to network, and to collaborate, because that's when we do our best work. And so really excited to be here and to elevate programming that's relevant and really important to serving the communities and families we care most about. And also just want to welcome you all as well. So thank you all so much for being here. We have a very exciting conversation planned. And, just really thinking about, it's been 1 week now since the state of California has opened up. So this is a very timely conversation. We've made a lot of progress as it relates to vaccine, sort of equitable vaccine distribution, but there's still a lot of work we need to do. So really excited to dive into this conversation and really excited to be in community with you all. And next, I'd like to hand it over to my colleague, Wendy Todd, who will serve as the moderator for this conversation. Wendy?
Thank you. Thanks, Anitra. I'm so glad you've joined our little planning committee team to help think through the programs and connect with speakers. So thank you for doing that with us. And I'm excited to get into this. So we have phenomenal speakers. We're going to have a panel discussion. And then we're going to talk about funding opportunities. Folks are going to share, you're all going to share with one another funding opportunities that you see that could be leveraged, that you know about, and then we'll end with some next steps. But yeah, I'm excited to have this conversation. So we're going to be talking about the equitable rollout of vaccinations and what we're seeing and what community health centers and other nonprofit organizations, the role that they're playing with that rollout and what the capacity needs are for organizations to continue playing an important role, and what philanthropy can do and what role philanthropy can play. So the way we're going to do this panel discussion is we've asked our panelists to do something almost impossible, which is to keep their comments relatively brief. I know that each panelist has a lot to say and a lot of information to share, but we've asked them to keep it relatively brief so that we could open it up for a group discussion. We want to hear what's on your mind, what questions you're grappling with, so that our panelists can help shed some light on questions that you might have. So we're going to do sort of a round of three. The first question's going to focus on successful efforts that have been done to increase access to vaccines for Latinx, farm workers, Black and Black people, and BIPOC folks. I guess I'm not sure if we're going to, what direction we're going to go and what population, but just recognizing that there's different populations that are experiencing inequities. And so what are the successful projects that have been going on? And then next, we're going to talk about the capacity needs of community-based organizations and health centers. And then we'll talk about action. So after each one of those that the panelists share their perspective, we'll do a Q&A and open it up for all of you to share your thoughts, your questions. So I'm going to introduce our panelists, and you can also go to the event page to read the full bios of our panelists. And so I'll introduce Andy Martinez Patterson, who is the Senior Vice President at California Primary Care Association. And Andy's has been a longtime leader around understanding what community health centers are up against and being an advocate for them. And she is also the mom of 2 children that light up her world. So thanks for being here, Andy. Diana Ortero is the Director of Special Initiatives at Latino Community Foundation. And Diana's had 15 years of experience in immigration advocacy and is now on the philanthropy side of things. So excited to hear Diana's perspective. And Diana's an avid soccer fan and will root for anyone who's has a Colombian on their team. And then Jessica Paz Cedillos is the Executive Director at School of Arts and Culture at the Mexican Heritage Plaza, and has some really great examples of things that have happened, successful projects that have happened, and understands the gaps that still exist. Jessica is the daughter of immigrant parents from Mexico and El Salvador. And I'm really happy to hear from all of you. We started when we did it, this is a 3-part series. So we're in the second part. In the first part, we talked more about the vaccine inequities and the rollout. And what we're seeing now with the statewide data is that in some communities, the vaccination rate is at as low as 45%. And in other communities, it's as high as 70%. So I think there's a lot of reasons why. And we're here to kind of dive in and talk about that and see what some solutions are. When you look at the data by population, Latinos have received 27.5% of the first dose of vaccine, but make up 39% of the eligible population. So there's a 12% percentage gap there, while white people have received 35% of the vaccine, or 35% are vaccinated and make up 38% of the eligible population. So really interested to hear about what are the systems that are creating these disparities and what can foundations do to address it. So let's start out with talking about some successful efforts. Let's look at what's worked in some communities, and maybe there's a way to build on that. So Andy, I'll start it off with you. You want to share?
Great. Thank you, Wendy. And thank you everyone for having us. So I'm here, for those who don't know, California Primary Care Association. We're the statewide association representing community clinics and health centers across the state. I was very, very, very involved at the beginning of the vaccine efforts because we were working with the state, really wanting to leverage the community health center network. A lot of the examples I will pull today come directly from the Bay Area health centers and the consortium there. But just want to start with, in January, I think it was December 31st, we had a call with Secretary Galley asking, like, what are we going to do? Let's use a community health center network. We were pumped. We were so excited. We started working on a program. And then quickly after I think what felt like a brilliant idea on paper with the Blue Shield infrastructure and the TPA quickly devolved into a very challenging situation. And I actually think that some of the disparities in part are because what felt like a good idea on paper, a race to vaccinate via a central model with an entity that had no connection to the local community or trust or new people, was terrible, absolutely terrible. And I hate to say that because I am a collaborator at heart, but what we were asking for from the beginning is what health centers have done that has been successful, which is just give us some vaccines. Like, we know exactly what to do and who to work with. Our communities trust us. This is a trust effort. And I was so happy to see the general operating support, because the CBOs that the health centers work with, the health centers themselves, the consortia who are aggregate and support health centers in various localities like San Francisco and Alameda, the general operating support enables them to exist and to have relationships and to be in the community and to know the community and have community health workers, and then to do vaccination programs the way that the community would want it done. I think the way that the state tried to roll it out, sexy Silicon Valley-esque, maybe works for 20% of the population, but for folks who, are on paid limited phone subscriptions, don't have resources, don't trust the government at all, that's not the model. So what has worked, the mobile vans that health centers have, the mobile clinics that they've been roving around, especially when we have really high vaccination rates in certain communities. So the mobile vans have been a really big deal. The community health workers, the promotoras going door to door and canvassing and just having conversations everywhere. The CBO relationships, for example, one of the health centers in the Bay already had a pre-existing relationship with the Billy DeFrank LGBTQ community center, and they had already been doing HIV testing. And so they moved that into COVID-19, and those same faces were the same ones doing COVID-19, talking about COVID-19. So that worked really well for the LGBTQ population there. A lot of health centers moved their Every Woman Counts program quickly into providing resources on women hygiene products, and then also talking about COVID-19 and just kind of wrapping in all of those social services. We've been partnering, some health centers with farm workers in particular have been partnering with LISC to have free transportation to sites, but also just going, I know this is a Bay Area, but for the Valley, you set up, you work with the growers and you set up shop in the camps and you just keep showing up. And if it's the health center that has been doing that for a long time, that's the way that it works best. There have been Friday night events so that it becomes a community party and a joyous occasion. There's music and dancing and fun, and then they'll do vaccines. So I think that which worked best are long-term community health centers and clinics who have established themselves decades in advance, have the relationships, and all they needed were the vaccines. I will say at this point, we are at a place where we knew it was coming. Feels shocking that it came as fast as it did. Health centers are giving back vaccines because they're expiring faster than we can give them out. But that doesn't mean that we don't have a lot more to do. It's just more a matter of, I think now is a time game, continuous conversations, continuous reinforcement, and just not necessarily wearing people down, but building up trust where they feel safe enough to do it. And then it's still going to be the trusted messengers and the trusted partners in the clinics and the health centers that are best to deliver the vaccine. Thanks.
Thanks, Andy. Really appreciate your statewide perspective. And now we'll go to Jessica, who offers, an on-the-ground local perspective. What's worked, Jessica? What are you seeing?
Sure. So before I begin, I want to give some context, right? So we're the School of Arts and Culture at the Mexican Heritage Plaza. We're the permanent operators of a local gym here in the community, La Plaza. In addition, we are part of the Si Se Puede collective. And so the initiative that I want to talk about is the Protégete campaign. So the 5 agencies that represent the Si Se Puede collective are the school, Somos Mayfair, Grail Family Services, Amigos de Guadalupe, and Vegilution. And amongst the 5 organizations, we are stewards of about 12 acres, right? In addition, we have deep ties with our community, and Somos in particular, they have used the promotor model to increase literacy in the community, right? So when the pandemic hit, we knew that we needed to pivot our programming in order to address the needs that our communities were facing. And so we advocated for La Plaza to become a food distribution site, a testing site, and then a vaccination site. In addition, we trained our promotores in order to do the door-to-door, right, to deliver the messaging and to encourage vaccination. As a cultural institution, we also activated our local artists and multicultural groups in order to develop culturally relevant messaging. Right now, the success of our approach, and it did not come easily, right? We had to fight and advocate for both city, county, and private entities to take our approach seriously and invest in it. And what we were able to demonstrate is that, given the disparities that existed, right, here in Silicon Valley, stark economic divide, you have Mayfair, which is a working class immigrant community, Vietnamese community, compared to the rest of Silicon Valley. We needed a layered approach, right? And so for us, what that meant is, we needed a vaccination site that wasn't going to be at Levi Stadium, right? The fairgrounds wasn't working. We needed a vaccination site that people could walk to and could drive to, and we were able to demonstrate demand. What also, helped us in this partnership is we partnered with Gardner Health Services, which is a community clinic that is led by a Latino and people of color. And so when people came to receive the service, they felt welcome, right? We had people who were going, to Levi, who were going to other county agencies, and they were either denied, they didn't feel welcome. And so they encouraged folks to come here because the experience was different, right? Like they walked in, we spoke your language, right? We were going to sit with you, we were going to help you fill out your form, and we weren't going to make it hard. And so I think for us, right, and just to demonstrate the success, right? So in our zip code, 95116, about a month ago, we were tracking in parallel to the county average. So 50% of our folks had been vaccinated. Now, currently, 70% of Santa Clara County Latino residents that are 70 years or older have been vaccinated, right? And I think that speaks to what happens when you have, trust with community, and when you have, sectors investing in those strategies.
Thank you so much, Jessica. Really, really helpful and amazing work that you did. Wasn't easy, I'm sure, and great to lift up the partnerships, because it sounds like that is a key strategy. Yeah, Diana. You want to share from the foundation perspective, successful projects?
Yeah, thank you so much. And thank you very much for the invitation. I feel like, as we know, the coronavirus is taking a much heavier toll on our communities. Latino Black people in the United States are dying at much younger ages and at a rate almost 3 times that of white people in the United States. And despite being disproportionately impacted by COVID-19, Latinos in California are getting vaccinated at a much lower rate. And as the foundation, we wanted to make sure that we supported the efforts of grassroots organizations that are doing amazing work in the community so that they can try to help as many Latinos as possible to get vaccinated. We know that so far, 5 million people, 5 million Latinos in California are getting vaccinated, but we still have 7 million to go. And so I know that in the Bay Area, the numbers are much better, like San Francisco, Marin counties, like we are doing a lot better, but in the rest of the state, unfortunately, that's not the case. So we wanted to make sure that these nonprofits keep getting the support they need to continue to do their work. We know that one of the strategies that have been working for them is like doing pop-up events. And for example, here in Redwood City, the Siena Youth Center have been organizing several pop-up events because they know that perhaps bringing the community to them is easier than asking the community to go to different locations, as Jessica mentioned. That is they have to deal with transportation, their schedules. There are so many factors that perhaps do not allow them to participate in these types of events. So making sure that they have something available for the community where they are at, that definitely help. And one of the, after doing several of these pop-ups events, they were able to register for vaccination and actually get people vaccinated on site. 800 people were able to get vaccines, and it really proved that it makes a huge difference when you have someone in the community supporting them. We know that the lack of internet connectivity remains an issue for families most impacted by the pandemic. And for example, one of our grantee partners have organized several pop-up events also in King County. The name of this organization is Valley Voices. And what is very interesting about them is she goes every week to this popular flea market called El Remate. And they help people to set up for vaccination appointments on the spot. So they know that every week they're gonna find people from Valley Voices at El Remate ready and available to help them scheduling the appointments, doing it in Spanish, and really helping them through the process. At times, even driving them there, because it may seem easy for other people, but we have to understand that we work with communities that have and face different challenges. So that has been very helpful. And I think that it's very nice to know that if people will be able to know that this particular partner is always in the community, and maybe they are not ready today, but in 3 weeks they are ready, they know that they are gonna be able to find Valley Voices in the Remate waiting for them to support them. And that has been very helpful. Many of our grassroots partners also are using the power of promotoras, community organizers, youth leaders. We know that the community trusts them. We know they are from the community. These are people that are part of the community, and their messages and whatever they said, people are gonna trust and believe because of the relationship that they already have with the community. They're doing a lot of door-to-door. We know that in the Latino community, word of mouth is really important. Like, yes, we have a lot of people watching a PSA on the local Univision or Telemundo, but if the comadre or the compadre tells them to do it, they will go for that. And so we are really investing as well on the promotoras model, and having the leaders in the community spreading the word and making sure that we get as many Latinos vaccinated as possible. We know that if, for example, right now, if parents don't understand how to schedule an appointment or where to go, they're not going to take their kids to get vaccinated. They are not going to sign consents to do that. So we need to continue invest on those type of messages. And having access to the appropriate COVID-19 information is vital. We have learned that simple messages work best, and that tailoring the messages to the particular communities, because what works good for a parent may not work for a teenager. So we want to make sure that each of them have access to the right and appropriate content and information. We know that one size fits all model doesn't work. And it is important to, as I mentioned before, to segment the population and customize the outreach and educational efforts to make sure that no one is left out. And definitely something that we have seen that has been very useful is, again, trusting our community partners. They know what they're doing. They're being in the community doing an amazing work, and they know their community. So this has been some of the examples where in places where it was really hard to bring services, where people don't even have access to internet, they are getting vaccinated because of the amazing work of these nonprofit organizations.
Thank you so much, Diana. I'm looking forward to hearing from the audience what questions they might have about these successful strategies. I really appreciate that what I'm hearing from all of you was that obviously trust is a big barrier and a big and also a big strategy for for successful interventions. And to me, this is an opportunity to look at what's worked well and then to reimagine the healthcare system based on these really successful strategies that have worked. So trust, the partnerships that have evolved, tapping into messengers, trusted messengers, customizing messaging, location. It's like, it's all of these really important ingredients that have shifted, and hopefully this will actually shift the way healthcare is thought about and delivered in the future. So I want to open it up, and feel free to just jump in with your question. Audience members, maybe there's a question you want to hear more from the statewide perspective and what happened or is happening at the state to reduce inequities, or maybe you want to hear from Jessica more about the partnership piece. I know that's not easy to do, and what helped make that possible, and maybe from Diana to talk more about promotoras. I have questions for all of them, but I want to hold back and really hear from this group. Alicia, you had raised your hand, go for it.
Thank you. Good morning. My name is Alicia Contreras. I'm the director of the Spanish-Speaking Citizens Foundation in Fruitvale. And I love this panel, and I just want to share a couple of things that have worked for us that I didn't hear.
Great.
Just to share. One strategy that we used was to having the opportunity of paying youth with paid job. I actually did the experiment and worked really well, because many of them were working part-time in restaurants and other places. It was like a seed that just grew inside of those places. They were the ones who first were vaccinated and had access to the manager of big organizations in the food industry. So like just one youth, because of him, we were able to sign up like 100 people. And my next strategy is, with that list of people that was vaccinated, the same youth, to be able to call them and say, now it's your kid's turn, and I can do the appointment. What has been a challenge for me, and I mean, I have to say I have had some health issues, so I have not been able to participate in everything, but finding the funding the RFPs has not been easy for me. And in fact, we did all with zero funding for COVID. It was actually just, I had opportunity to put it as part of the program, instead of just, tutoring the kids, having the opportunity to hire them. That's how I did it. But I would be very curious. My question would be, is there a place where we nonprofits could find more easily and connect with the funders who are funding this so important effort? The last thing that I'm going to mention that I didn't hear and I would like to point out is that I am shocked in how much there is much better coverage of all the problems with people who get the vaccines than coverage of all the benefits. And in the Latino community, the biggest barrier that I'm seeing is that people are more afraid of 6 people who died because they had the Johnson and Johnson or whatever vaccine, but they are not hearing that millions of people are being saved with the vaccine. And I really think that there is a huge need of united effort for us to counterpart that messaging. That's all I'm going to say.
Thanks, Alicia. Thank you. And I'm going to kick your question about funding over to Diana to see if are there places for nonprofits to find out about funding? And I love, the promotora model is a win-win-win. Promotores are paid, right? And like young people are paid. So like, how do you find out about that? And then I'll ask Ariana. She's been holding her hand up for her question. Go ahead, Diana.
Yeah, I think that that's definitely one of the challenges that we have right now. There are several nonprofits doing the work without any resources. I think that that's something that is happening a lot, that many of these nonprofits have been doing and provided different type of services. And on top of that, they started like also providing services in terms of COVID-19. And I think that one of the advices that I can provide to them is like, I feel like we might wait until we need to establish a relationship with something is happening and maybe reaching out to those foundations before. And I know that we are now in the middle of the pandemic but it's a good time to, there might not be openings, but please reach out to Silicon Valley Community Foundation. I see Jamie from CCI, reach out to all the foundations you might know and ask them, because for example, we started to create and I will talk later about our Love No Fear Fund, but it's by invitation only, so it's not open to everyone. But I think that in my mind, the key message will be is a relationship and reaching out to the foundations to try to ask, and show the amazing work that they are doing. I think that's vital. Sometimes I feel like we as foundation, we don't know the amazing work that all nonprofits are doing, and it's just a matter of like reaching out to us, letting us know. Look the work that we are doing, look at my numbers, look at the impact, and we trust that they are doing the amazing work. So I feel like hopefully when we have more funding, we will be able to present it to other nonprofits.
Thanks, Diana. In a perfect world, there would be a website that you just say, I'm working on equity vaccination rollout in an equitable way, and here's a pot of money. And unfortunately, it's very fragmented. But if any of you do know any other answers to Alicia's question, feel free to, maybe the magical website does exist. Feel free to put it in the chat. Ariana, you've been really patient with your question. Go ahead. It's good to see you.
Thank you, Wendy. Hi, everyone. My name is Ariana. I'm with Community Foundation, Sonoma County up in the North Bay. And first, I do have a question, but first I want to say that what Diana said is spot on. What happened with us, I feel like we were very lucky because we had a group of nonprofits who already had promotores and trusted messengers. They came together and started meeting early on in the pandemic. And when the vaccines rollout started happening, they reached out to funders and invited us to join their meetings just to listen in and hear what their needs were. And so that's how we were able to fund some pop-up events that were happening in the community to get vaccinations out. How we were able to fund some support for trusted messengers, and then just help fund the coordination of that very informal group that had come together, but clearly they were dedicating a lot of time and a lot of nonprofit resources to collaborating and coordinating in that way. So for us, it was great to have them reach out and say, hey, this is happening, come join so you can listen in and see what our needs are, instead of having to set up individual meetings just for us to present on what they were doing. So that has worked out really well for us. And my question is for Diana, actually. It's about the promotoras model. And what I'd like to learn is what type of support was provided to them, or what type of funding was provided so that they could go out and get trainings that they felt that they needed. Because one thing that we kept hearing from the trusted messengers and promotores that were on the ground, they know the people, they know the communities, they can go door to door and talk to people, but they didn't necessarily have the connections to the people in the county that knew exactly what was happening in terms of when vaccines were coming, or when certain things were going to become available, or which health clinics had access to certain vaccines. So they felt like there was a disconnect there, and they wanted to be in the know and have the up-to-date information to then share with the community members. So that's what they came back with to kind of ask us about. And I'd like to know how LCF approached it.
Thank you, Ariana. Well, one of the things that we did was definitely supporting these organizations that had already the Promotoras program established, so that we can just inject more capital and they can continue to do their amazing work. And the key to us also is being able to build relationships with the community partners that we have. And we were able to connect them with the already partners that we were working with. For example, Kaiser, we were working with counties. So we were the bridge between the nonprofits and the organizations. I know exactly what you are referring to. There are times that people know they are available to do that, they have the willingness to do that, but they don't know the how. And we were able to connect them with the right information and providing the right tools. And so they were able to be trained, get access to the, not only it's not just a matter of like sending them the right website so that they can search the information, but having someone to talk to. Who will be the person that they can talk at the county level? Who will be the person that they can talk is there any doctors available that will be able to give presentations? And we have those. So we were able to connect them. And so, but I'm really glad that because these organizations were ready and have been doing already extraordinary work. So it was just a matter of like providing them with a little bit more support so that they were not doing work for free. Because that's the thing that I feel like they cannot be doing. Right. We need to support them so that they can continue doing serving the community and get them vaccinated.
Thanks, Deanna.
Wendy, can I chime in really quick?
Yeah, I think I'm going to go. Jessica has a local example that she's going to share, and then I'll come to you, Andy, just to say that I really appreciate Deanna lifting up that role that funders can play in the connector role. And that's huge. Jessica, go ahead. You have
So I love this question, right? Because I think that there are a lot of connections, right? So one, the Latino Community Foundation did fund our pivot and the work that we're doing with our promotores here in the community. But the way we work with our promotores, one, they've always been paid, right? So prior to the pandemic, our community workers have been paid and at a living wage, right? Now, the beauty of what was able to happen, right? I don't think it is not okay for us to do this work for free, right? And we cannot ask our residents and our community workers to do this work for free. So the Si Se Puede Collective went to bat. We went to the county and got a $500,000 contract to work with community who was going door knocking and getting the messaging out in order for folks to get tested and vaccinated. And they were getting paid at the rate of $35 an hour, right? So I think one, we absolutely understand the strategy and they were effective, and we needed to honor the fact that they were doing that work, right? Now, as it relates to the training, right? We didn't just say, okay, we have our community workers, right? We're going to send them off. They're going to do the work. No, we as the nonprofits and our staff were the bridge to county officials, right? So we had weekly calls with county officials, and our promotores would join us on those calls, and we troubleshoot. We'd be like, this is the problem that came up this week. How do we go about addressing it? Hey, we're sending them to the county site because they got COVID, and you're taking a week to get back to them. Right. And so that is how we work, because the thing is if our community workers have trust, if we are telling them to access these resources and then it's not available, it looks bad on us. Right. And there was a feedback loop that was very important, but we established that early on.
Awesome, Jessica. Your coalition sounds incredible. Really great. Andy, go ahead. You wanted to jump in.
Yeah, I just on the clinic side, just to acknowledge the important, I mean, in some ways, I think we all feel like on the healthcare side, there's too much money, which I don't disagree with, except for the fact that healthcare is really complicated. So we have these, I had a role at the state level that was important to try to, like the state's like, we want to work with health centers. So they came to me, right? But I can't work with, we have, 1,400 FQHCs and clinics across the state. I can't talk to 1,400 people and try to give them all the information. It was and we're federated in California. So that was one lesson learned, is in a federated model, everyone has very different relationships. And maybe, San Mateo is having one message, Santa Clara has another message. The clinic operates in both places. The promotoras are in both places. It's really confusing. So we have layers of communication streams. And for us, it was really important that the health centers, the clinics, and the staff themselves, they just were given the information, but they didn't have to participate in the coordinating efforts. So that's unfair that when they're the ones who have to be the ones testing and setting up the sites and doing all of that. We have the system of, and I'm a state, and then we also have these, what we refer to as consortia. So like the San Francisco Community Clinic Consortium, and they are the aggregator of the health centers in San Francisco, so they can talk to the county. And a lot of the time, it was wrong. Like it was wrong information going back and forth to the troubleshooting. Every week it was like, that's not what you told me last week. To ask the providers themselves or the promotoras to do that, like to navigate that strange space, is just a different skill set. And I don't think everyone should be required to do it. And it's one of the lessons learned, I think, which we'll get into in a second, is what did we learn from this process that we never have to go through again? Because there were so many unnecessary hiccups, but I just want to underscore the importance of the CBOs and the role that they play between the top and the bottom. You have to have, otherwise you're asking the bottom to try to figure out the top, and the top assumes they get the bottom. So you have to have the space in between. That's just so important. And they are successful when they have enough resources to just be and to constantly interpret from both sides, bottom and the top, to make sure that it's a fluid, continuous movement between.
Yeah, thanks for that, Andy. And you're setting us up really nicely to talk about the capacity of community-based organizations and the health clinics. What's needed, moving forward, trying to still get our way out of this pandemic, still trying to get more people vaccinated, recognizing that there's complex barriers in place. Jessica, I'll turn it over to you to kick us off on this.
Sure. So when I think about, the vaccine strategies, I think we all recognize the importance of a layered approach. Now, how philanthropy, how city and county government, state government can help community-based organizations do that work is by investing in them, right? And general operating support for an organization to do work that is life-saving is important, right? And so I want to be able to uplift that. And I did see in the poll that ranked highly. And I want to emphasize trust, right? So what the Si Se Puede Collective went through and what the Mexican Heritage Plaza went through in order to become a food distribution site, a testing site, and a vaccination site, it should not have taken that long, right? And in a moment, right, where we were in an uprising, we are in a global pandemic, right? We had officials set up a testing site at a police facility that was not being used, right? And had it not been for the collective and community, right, knocking on doors and saying, or picking up the call and saying, what are you thinking, right? Like this is a local asset here, right, in the community. We have the strategy to get the word out, to do the outreach. You need to change that, right? And fortunate, right, we did become a testing site. We then became a vaccination site, and we were able to demonstrate why, right, community-based organizations that are particularly ethnic-led, right, that have worked with community workers can be successful, right? And so I think the trust factor is very important, and you see the results. So here at La Plaza, in this community, we vaccinated 25,000 people, right? That's a lot of folks. I think the second thing to acknowledge is that, inequity existed long before the pandemic, right? What the pandemic did is it put it front and center. And so as we enter recovery, right, we can't do business as usual, right? And it's important for us to invest in strategies that are addressing both the direct service, but also the systemic change that is needed, right? And so we hear a lot about there's a lot of stress, right? People there, as it relates to the mental health of our workers in our community, they're at a heightened level. Guess what? Pre-pandemic, folks who were working 2 to 3 jobs, folks who were sending their kids to a school that is underperforming, folks that are living 2 to 3 families in one household, they were already stressed. And so if you actually want to get to that, yes, we need mental health services, but if you're not addressing the systemic issue, you're not getting it, and it's not going to be effective, right? Because someone will always choose to go to work, to put food on the table, before taking care of their own personal needs, whether or not it is right, right? And so I think that that is important.
Jessica, I was wondering if you want to elaborate a little bit more on this idea of trust that's come up both, as a strategy for engaging community residents, but also a strategy between nonprofits and funders, whether it's public or private. And I'm wondering, as we're all listening in here, are there any, is there anything that helps facilitate that trust? Is there anything that you would recommend, call out, that this is what helps to be in trusting relationship with community members and or with funders? Anything off the top of your?
Sure. So, I mean, the relationship building aspect is important, right? And so I can speak to what we've done here at our organization and also on behalf of the Si Se Puede Collective. So we have built trust with our local funders who actually were very good in converting programmatic support to general operating support. For us, the real struggle, right, was working with city and county officials. And part of that is it's a bureaucratic process, right? You've got different people wearing different hats. We're in a pandemic. We don't envy that, okay? It was hard. We understand. And, right, when you think about how city and county contracts work, often they're going to an outsider, right? They're bringing in the expert to do the work. And what we're saying is we are the experts of our local community. And so we went to bat, right? We had conversations with folks. We had to educate folks. We had to say, here is why our strategy works. And here's an example. And here's why it is important for you to invest in this strategy. Now, it is, an inside outside game as well, right? And it's not always pretty. And it's important for us to listen, we got to work with institutions, right? And there are times where we also need to escalate in order to be heard. And so all of it was used, right? We had different strategies. We had people calling on our behalf, which was incredibly helpful, right? We had community who was saying, what is happening, right? Like we need to think about this differently. And so all we are asking, right, is you're going to trust a corporation to be innovative and to fail. Can you also trust nonprofits, and in particular, community-based organizations that are run by people of color, to innovate and to fail too? I mean, that's what it's about.
Thank you. Yeah, that's great, Jessica. And it kind of reminds me of Deanna's point earlier about in the philanthropy role, if you're tuning in as a funder, you can open doors with public leaders, with government officials sometimes that nonprofit leaders might be struggling to open, particularly people of color who are running nonprofit organizations. So I'm hoping that that message is coming through here. Andy, so let's turn it over. Oh, I'm sorry. I think I saw a hand up before I turn it over to Andy. Did somebody want to jump in and ask Jessica a question? Okay, I'm going to turn it over to Andy to talk more about the capacity of community health centers to be able to roll out the vaccine in an equitable way. What are you seeing?
Yes, I will do that. I just want to underscore what Jessica is saying. It struck me, I came to Community Health Center World for being an organizer in Minnesota, and it was a chosen academic course because I didn't like my master's program at all. I didn't think it was teaching me anything, but the organizing that I sought out was teaching me something that was really fundamental. And I just want to underscore the poignancy of this moment with COVID, because I'm a big supporter of, Governor Newsom. I'm a proud Californian. I'm really happy to be here, but this, like the drive for the sexy and the new and the tech solution or whatever that is, it completely undermines everything that is usually talked about in community, in whatever community and trust. And it takes time. It's like right? Tech is fast, trust is slow. It's really, really slow. And we have undermined all our community institutions, decades over decades over decades, right? There's the lowest rate of Girl Scouts that we've ever had, of Boy Scouts, of sports, like a church institution. Like, we do not have institutions of trust anymore. And to keep saying like, well, we'll just throw an app out there. It doesn't, that's what they tried to do. And on paper, it seemed fine if you like, for all the rich people in Silicon Valley who can figure out how to use the app and to download it, but it didn't work for most people. I'm like, 1 in 2 children are born into Medi-Cal. We have a really low, we have a poverty state. That's a big, like, we need to flip that. This is an opportunity to flip all of that and to invest in what feels, and it can be sexy. If we want it to be sexy, community organizing can be really sexy, can be really cool. And I just really loved that point. Why can't you fund a CBO to thrive and to fail? Like, we need to see all of those things happen. So on the community health center side, I would just say, for me, community health centers, they came out of an organizing movement, out of social justice too. And in part, where we are today is in part a product of capitalism and of the healthcare industrial complex and paying for medical services. And it's devalues community. So we are a fee-for-service, volume-oriented provider. Don't get me wrong. I love health centers. I've been here for 13 plus years. But what COVID amplified is how wrong that model is and how we've run it out. It built up a really strong system, and we should be proud of that in California and the United States, but it is time to flip it and go back, allow a patient to say, I don't want to come to you. In fact, I don't have a car and I don't have bus fare, right? I want to call you and make sure that like I'm doing okay. And COVID, finally the payer said, oh, okay. Because we can't lose the whole system. We'll pay for that care. And actually it turns out it's okay. It's okay. It's not less care. It's not worse care. It's and the patient values it. It flipped it to who the patient valuing something as opposed to the payer saying that matters more to me than what the patient wants, losing a day of work, childcare, all that kind of stuff. So we are flipping it. So for me, yes, we're going to keep doing vaccines. We're going to build it in. We're going to keep doing all of that stuff, but it's less that, and it's the opportunity to flip the healthcare model over. And that's what we're using it for. And just to exemplify the trust concept, CBCA had been partnering in a trusting relationship with the California Healthcare Foundation. And the moment COVID hit, and we were talking to the state saying, we can't pay for a volume service. Like, this volume oriented model doesn't work anymore. And the state said, you're right, we need to flip it over and pay for value. Let's move to a population health model where we pay you to keep people healthy as opposed to pay you when they're sick. The foundation was right with me almost on the second call that I had to say the state's interested, and they said, let's go. And then they moved the work immediately. And it was built on a trusted relationship of committing to a vision. And I'll just say from the clinics, it will be 12 years by the time I get it off the ground. It just takes a long time. And it's well worth every single second that we've put into it. It's been painful, but it was trust, and it was waiting for that moment in time. But I would say it's not just the moment in time to flip the health center system over. It's the moment in time to flip the inequities in this entire country that will make the next pandemic so much worse, and to fund and make it sexy, CBOs, like all that kind of stuff. Like, that can be really sexy in the general operating funds, that we should do that and move a little bit less away from the kind of the star-spangly apps of Silicon Valley and invest in the community, just as Jessica was noting.
Thanks, Andy. And so I'll ask you another question actually related to that. So if there's a funder on this meeting that is interested in supporting community health centers to flip the switch on the healthcare system and is thinking about like, yes, hashtag sexy community organizing, right? Like, any tips on, how to have a funder think about doing things different, supporting community health centers in a different way?
Yeah, so I will have a much better answer. One, I would just say, let's be friends, because there's going to be a ton of health centers that want to do this. We are aiming to finalize the details of what this new model looks like in October. And then the first health centers who can do it can apply in January to start in 23. But we're going to need, changing your model from come to me, let me come to me, to please don't come. Like, let me make sure that you're really healthy is a totally different mindset. And we are starting the process this summer to figure out with the 63 health centers so far who have said, I'm really interested in this. We got to go. I love telephonic. I want to do more patient home monitoring. I want to do all of these things with my patients. I'm really into CalAIM, the state's new Medi-Cal program and directive. I want to leverage all these opportunities for the better. Over the next 6 months, we're going to be trying to figure out what is it that we need. Do we need better data analytics models? Do we need more coders? Do we know that we need to hire more promotoras right now? Or is it more nurses? Like, what do we need to be doing as we're starting to flip these models around? And then we will have a much better sense, I would say, at the end of 6 months, the type of programming and what health centers individually need in their communities and for their own systems in order to successfully transform so that they can provide all the wraparound and support services to the patients.
Awesome. That's so exciting, Andy. Deanna, I'm going to go to you to hear what actions philanthropy could take to support resiliency around community health centers or community-based organizations that are trying to level the playing field around this vaccine rollout.
I honestly think that we must move flexible resources to our grassroots organizations, those closest to the community, the essential organizations that are witnessing how the pandemic has affected our communities at higher rates and are working tirelessly to support them. We know that COVID-19 has stolen the Latino Community Foundation of a generation of fathers, mothers, grandparents, uncles, siblings. And while Latinos make up 39% of the state's population, they make up 56% of COVID-19 cases and 47% of deaths. So in order to ensure that the most vulnerable Latino communities survive the COVID-19 pandemic and that the nonprofits who serve our families do not cease to exist, the Latino Community Foundation launched the Love No Fear Fund last year. And I really think that the title of the fund is really meaningful because we know that it's about love. It's about support and respect our community, and the most importantly to me is to let them know that they are not alone and that together we're gonna get through this. Because in our most difficult moments, we lean on what makes us strong: our generosity, our culture, our community. And so, so far, I'm happy to report that we have been able to raise more than $5 million. We supported more than 100 nonprofits organizations across the Bay Area and also in the Central Valley. We're focusing on the Central Valley also because it's home to the most essential workers in our state. The most vulnerable families live in that area, but the less philanthropic support. They receive the less philanthropic support. So we want to also make sure that we amplify the work of the nonprofits in that particular area. And we know that our community is filled with trusted organizations who are hubs of hope, connection for Latinos, and these anchors just need investment and support. Mm-hmm. They just need investment and support. And what Jessica said, I think that we are in the middle of the Silicon Valley. We heard about like angel investors. We heard a lot about, I have a great idea, give me $1 million, and people are willing to do that. And so why not supporting these amazing nonprofits and CBOs that are working? They didn't open up 6 months ago. They have been there in the community for many, many years, and they're going to continue to be there, because if they're not there, really what's going to happen to our community? So, and one thing that I do wanted to emphasize, that it's not about charity. This is about love. It's about investing in these organizations that have been doing extraordinary work because the community depends on them. They were here when the pandemic happened, and the community went to them because they were going for seeking help with the rent, food, legal services, any other type of services. And so they're going to be there. We trust that they are best equipped to, and they have been best equipped to respond to this crisis because they are nimble, they are resourceful, and they have pivoted at their services to meet the challenges of our Latino families. And I think that this is the time that as a community, we make sure that these extraordinary organizations have what they need to continue thriving. And so with the Love Not Fear Fund, we have 3 different phases. The first phase is focusing on immediate relief, making sure that our community has access to basic needs, that they have what they need to pay their rent, that they can secure food. And we're doing this through our nonprofits, our community-based organizations and partners who are close to the community, because they are the community. Many of our, the workers of many of these nonprofits, They live in those communities that they serve. Their parents were farm workers, so they really understand what's happening, and we want to make sure that we invest on them. The second phase is focusing on strengthening these nonprofits. We want to make sure that they're healthy and strong so that they can continue to do what they know best. They know how to serve the community, and they do it with love and compassion. So we wanted to make sure that they are here for the long run. And the third phase is about investing in building power and civic engagement. We want to make sure that our young people vote, that they believe they have a voice, and that they can make changes and run for city council, because they can. And we want to have a bigger opportunity to make lasting change. We want to make sure that we unite our community to step up in their leadership roles, and so that they can address the root causes of this economic crisis, because we want to make sure that we can reimagine what the world will be and looks like post-COVID-19. And we need our community partners to do this. And so that's what we are doing. And I feel like just wanted to keep inviting everyone that is watching us today to keep supporting the amazing work that our grassroots organizations are doing.
Thanks, Deanna. I love the title of that fund and the mindset that there is enough money to go around, right? It's about how it gets directed. There is enough love to go around. So Jessica, I'm going to turn it over to you for any final thoughts around what philanthropy could do that maybe that we haven't talked about yet around supporting community health centers or community-based organizations to level the playing, like bump up those vaccinations, get everybody that wants to be vaccinated, and then I'll open it up for questions before we come into the home stretch of our discussion today to learn about other funding opportunities to leverage. Jessica, turn it over to you.
So I'm going to address it in two ways, right? As it relates to the vaccine, there are hyper-local examples that have been successful, right? And so invest in those strategies, because there still is a gap. When you think about Latinos who've been vaccinated in urban areas versus rural areas, there is a huge disparity, right? And we already have examples of a layered approach that works, so invest in that. The second thing I think for our funders on this call is y'all have an opportunity to invest not in an exit strategy, but in a regenerative community, right? And that looks different. Here in East San Jose, we have examples of that, and we are asking our folks to be bold, because we can't go back to the way things were in the past.
I know you have more to say, Jessica. Feel free. Yeah, feel free. I don't see questions popping up. So yeah, please go ahead. What does that mean, a regenerative community, and what's your call to action for foundations?
Sure. So for La Plaza and the Si Se Puede Collective here in East San Jose, we are in advanced stages of gentrification, right? We also know that this community was disproportionately impacted. And so we have an opportunity to really change the way things have been set up in this community in San Jose and in Santa Clara County. And for us, we are thinking about what does it look like to be property owners, not just of affordable housing, but also commercial spaces where we're able to invest in our families, in our residents, and to put them to work, right? Because when we think about the safety net, we know that that's needed, right? We're going to continue to advocate for that. We're going to continue to serve people in that way. In addition, we are thinking about what does it look like for us to take control of our community, right? What does it look like for us to step into that power and to dictate how things are going to happen in our community versus an outsider coming in and telling us what's going to happen, right? And so we're holding both perspectives, and is what we're trying to do here.
Thanks, Jessica. I think what we've heard, part of the theme of this is that we're all interconnected. COVID has really exposed how we are dependent on one another. And I just really appreciate that the nonprofits and community health centers have been, they've been working at the intersections all along. And I think foundations now are trying to retool and rethink about how to support those intersections and that interconnectedness. And so I really appreciate, Jessica, your leadership and your vision, and bringing folks along on that journey. So thanks for sharing that. And yeah, we started talking about this is a three-part series, and we started kicking around the idea of like recovery, what maybe the next Bay Area Health Funders session is around recovery, and maybe focusing on regenerative communities would be a hot topic. So we want to hear from you. We want to know what you want this session to be on, but that sparks my interest. So I'm curious, I know, Alicia, you've asked a question before. I just want to open it up to see if there's any other questions of folks that haven't gotten a chance to get their question answered. For our panelists, lots of information to digest. I'm hoping that there's some nugget that you're taking away from this, that you're thinking about making a change within your foundation or your community that aligns with what we've been talking about. I don't see any hands. Alicia, go for it. What's your question?
Thank you. More than a question, one of the things that I think I want to highlight what I think was fantastic as a result of COVID, and things that I have never seen before was that suddenly, like, foundations that we have a relationship with would send a check and say, we know that you're struggling. Here is this check for general support. I think we should learn from this, because that freedom is what kept us being able to pay the bills that many times foundations do not want to be part of paying. And the second thing that I want to also highlight is that often nonprofits are looked as the ones that are providing the service, but very few times we are seen as employers opening job opportunities for, especially for people of color. And what this means is that one of the things that was hard for us is because in our organization, we do everything we can to hire people of our community who are actually neighbors and can work to our facility. We all were very affected. I'm saying we because I am part of them. Some of us lost our moms. Some of us had family members who had COVID. And, to go back to normal, whatever normal is going to be hard. So I would like to make a pitch for every funder in this group to remember that nonprofits are employers, and right now any support to help us strengthen our capacity to pay well to our employees, because that is a change that is needed also. Sometimes when we are restricted to a small grant, that means little salaries, and we have to change that, especially being in the Bay Area.
Yes.
Our policy is like, for someone starting, we do not pay less than $18 an hour. That's just our commitment in our community, and that is still very low. My goal is that we can reach a pay that really help my staff to stay in Oakland and they don't have to travel from Hayward. That's all I want to say. Thanks,
Alicia. I'll never forget when I worked at a community foundation and I learned that the staff at an organization that we were providing support for qualified for all the public benefits because we weren't contributing to a livable wage cost. And I know exactly where I was standing. I mean, I just had this assumption that this organization had enough. And when I looked into the weeds and saw the salaries and realized that folks needed to struggle to get food, it was a real reality check. And so I encourage, funders are now coming into the space of doing basic income and funding advocacy around guaranteed income. Well, there's something you could do, which is like guarantee income for the nonprofit staff that your organizations are funding, right? I mean, so there's things that you might be able to do internally that get at exactly what Alicia is talking about. Any other questions or thoughts before we turn it over to Anitra to talk about some funding opportunities that we might be able to leverage collectively? Any other questions for our amazing, awesome, thoughtful, passionate panelists? All right, well, thank you, everybody. Thank you so much, Andy, Deanna, and Jessica, for taking the time out to educate us and really inspire and share your stories. It really means a lot to me, and I'm sure to others as well. And Anitra, the stage is yours.
Yes, thank you. Thank you, Wendy. And thank you to the incredible panelists for such a rich conversation. I was very energized by the conversation and recommendations. There's a particular initiative that I would like to elevate, the Together Towards Health initiative, which is a statewide initiative. It's essentially a public-private partnership, and it was created and funded through major philanthropic organizations to support on-the-ground community outreach to encourage uptake of the vaccine amongst the general public, really with the bend towards reducing the inequities and targeting communities that have been disproportionately impacted by COVID-19. The model is focused on coordinating support to local CBOs in coordination with California local public health departments to slow the spread of COVID, and then also just, again, to increase uptake of the vaccine and reduce inequities in highly impacted communities. This is this fund overall, the fund has reached 30 million. So 30 million has been raised towards the $50 million goal. So this is sort of a call to action to funders on the call. If your organization has not supported this effort, this is a major opportunity to support local CBOs throughout the state of California. This fund has supported over 400 CBOs throughout the state that are, working in their community and really educating local and, educating community members on COVID and helping folks access the vaccine, and working in communities that have been disproportionately impacted. Sunlight Giving, we have supported this initiative. It's been great to really see, to support a public-private partnership, but also to see philanthropy come together and create a sort of leadership table around really investing in community-based organizations that are often tapped to, to support local families. And so I wanted to elevate that. I added the link in the chat. So thank you.
And Anitra, you wanted to call out and invite other folks, right? That if anybody else had examples.
Yes, if anyone else have examples, if there are any other examples, if not, then next I'd like to hand it over to Renee.
I think Renee from Meta is going to share. Yeah. Renee, are you still, if you want to unmute?
Renee, are you going to share?
Go ahead, Catherine, go ahead.
Oh, sorry. Sure, I'm happy to share. Just to say, this is Catherine and Renee from Meta Fund. We are a funder here in San Francisco, primarily focused on older adults. And just to say that we're happy to provide information to other funders. We've provided about a little less than $500,000 to a handful of community-based organizations in the city, particularly focused on low-income older adults of color and their families and caregivers. Just knowing that so many older adults, when you look at the numbers in the aggregate, it seems as though we have a high percentage vaccinated. When we disaggregate the data, we know, in fact, that that is not the case. And so I think that our focus has really been with the organizations that we're supporting is to really talk to them about our interest is not in scale. The city has tried to do a very good job in opening up hubs and getting as many people vaccinated as possible. Our interest is in those people who really require a lot of time and energy and trust building, and in many cases, maybe homebound or need a place that's very, very local, a mobile unit or a local pop-up in order to get vaccinated. And so just to say, we were talking about the trust issue, and I think that we've really gotten a lot of traction by being very clear that Our goal is not volume. Our goal is relationship building with those people who need many touches and a lot of support in order to, whether it is to ultimately get a vaccine, but to have an opportunity to ask questions, to have an opportunity to get PPE, whatever it is that they need. And that from an external perspective may look quote expensive per person, but that's the population we are interested in supporting, and the organizations that have those relationships are those that we're interested in supporting. I did just want to say, if there was anybody on the call who was interested in looking at the very brief RFP we put together, or the types of conversations that we had with our potential partners, we tried to do a really abbreviated and easy process for people who were part of this handful of organizations. I'm always happy to share that information so no one has to recreate anything on that side. So, and happy to answer any questions.
Thank you so much, Catherine. Are there any questions for Catherine? All right, if not, then I'll hand it over to Sarah.
Thanks, Anitra. I'm just going to share something that another Bay Area Health Funder group member who had a last minute conflict and couldn't make it today emailed me this morning. So Sharon Vicaria from the Marin Community Foundation, she had reached out to share that they've been funding congregations in support of their vaccine work, and that they're hearing from the county in Marin that congregation-based mobile clinics have really been yielding good results. And she said that she didn't see as much philanthropic attention on faith-based organizations. So was just wanting to lift up that as an area where funding could be of value. And I think if folks are interested in connecting with Sharon around the work that they've been doing in Marin County, just let me know and I can help make that connection for you if you don't already know her. So I just wanted to share that, and then Anitra, I can hand it back to you.
Sounds good. Thank you for that. Thank you for that, Sarah. Well, we essentially have come to the end of our program. Thank you all. I just first want to thank our speakers for such an engaging and dynamic conversation, and also thank everyone for participating in the conversation today. We'll send out notes and resources today from the meeting along with the recording. Please stay tuned for dates and details on our next program. As Wendy shared, we'll be thinking about, get input from you all around what we should think about next in terms of our program. So we will be in touch, and thank you all again. We really appreciate the conversation and being in community with you all.